Hi guys, hello. I am Jewel and welcome. Welcome to my channel, guys. Okay guys, I hope all of you are doing well. I hope that your health is stable, that your families are doing great, and of course that you're all getting along and have everything you need. For us guys in my state, the summer heat has come. It was 90s during the weekend, and it's going to be all 80s, high 80s all this week, which means that a lot of people are outside now. There's more cars on the road. We are in phase 3, so that means restaurants are opening. Stores, a lot of businesses are opening again, which means for us with compromised immune systems that we still have to stay vigilant no matter what's going on, because COVID-19, of course, is still here. So we have to continue to wear a mask, our gloves, wash our hands vigorously, not touch our face. All those things that the CDC has told us to do, we need to continue to do, because of course we have compromised immune systems as CKD patients, and of course all those people with compromised immune systems, of course, need to follow the same guidelines. But guys, today I wanted to bring you a story that it resonated with me very, very much. It's coming from the National Kidney Foundation, and that story is kidney transplant patient beats COVID-19 after 6-week bout of the deadly disease. Like I said, this story really resonated with me because I have a transplant, and all transplant patients, of course, we're being very, very careful, because according to the National Kidney Foundation, transplant patients that catch COVID-19, it is really wrecking their health, and they're losing their kidneys. So this is a time that, of course, all of us has to stay very, very vigilant, not in fear, but only in caution. So guys, let's get started. The symptoms of COVID-19 were difficult for Mary Ann Starrett, a 5-year kidney transplant patient, but not as hard to deal with as the anxiety she felt about the disease damaging her kidney. Mary Ann, 61, of Cleveland, Ohio, tested positive for coronavirus on March 30th. The first week she had intense headaches and fatigue that kept her bedridden. The next week she was extremely dehydrated from constant throwing up, diarrhea, and fever. And the third week she was easily out of breath from even the shortest walks. And all in all, it took her a full 6 weeks to recover, thankfully entirely at home. I think the hardest thing was the anxiety that I would go to the hospital and not come home, said Mary Ann. I didn't want to never see my family again. There was one night I didn't go to sleep because of fear. I even had dreams of being taken to the hospital. Her sister's gift of life. Mary Ann received a transplant 5 years ago from her sister, who was her living donor. She needed the transplant because she has IgA nephropathy and was diagnosed 13 years ago. 3 years ago, before her transplant, her kidneys failed and she went on peritoneal dialysis. It wasn't easy with the teenager still at home, but she made it work. She changed careers to a stay-at-home job when she received the transplant. As an occupational therapist in a school, she felt she would put her compromised immune system at too great a risk. Now she is a customer service rep for the cruise industry. Despite caution, she still got COVID-19. Though she was already working at home and has always been cautious about her risk of illness, she still contracted coronavirus, most likely from her husband, she said. He was sick with a mild flu-like illness for about a week right before Mary Ann contracted the disease. Her husband's doctor decided to not bother testing him, she said, because it was very mild and he was over it quickly. But ever since her transplant, both her husband and Mary Ann have followed strict hand-washing guidelines. She was active, a walker, and enjoyed a good life, she said. Social distancing wasn't new to her. She stayed away from crowds, and after she first started hearing about COVID-19, she began to step it up and only made occasional trips to the grocery store. She even had a supply of dialysis masks. I haven't gone to a grocery store in weeks, she said. I kind of would like to go somewhere though. During the bout with COVID-19, Marianne lost 18 pounds, mostly because she could barely eat for days on end. It was hard to walk to the bathroom, she said. I was very weak. It has been 7 weeks since she tested positive, and she just started working her home job part-time. She is finally able to walk a few blocks around her neighborhood without getting short of breath. Her advice to others. I am very thankful for the support of my husband and family throughout my illness, she said. Her most important advice for any transplant patient is to seek emotional support during these scary times. She is grateful for the many nurses and medical personnel who answered her daily calls with questions. In fact, while she struggled with the virus, she got daily calls, sometimes 3 times a day, from her team of doctors and nurses checking on her. Ask a lot of questions, she advised other patients. Reach out for your support as much as possible. Talk about the anxiety that this disease creates. I listened to the nurses and it really helped. Learn more about COVID-19, how it hits people differently, and it is especially hard on patients with kidney disease and with transplants. It is important that you take measures to keep yourself safe and reduce the chance of getting COVID-19. Be sure to wear masks when you go outside your home. Keep at least 6 feet distance between you and other people. Remember to wash your hands frequently and use hand sanitizers if there are no washing facilities. Avoid touching your eyes, mouth, and nose. And for more information about precautions and considerations for kidney disease patients, transplant recipients, and living donors, visit kidney.org/COVID-19. Okay, guys, this was Kidney Transplant Patient Beats COVID-19 After 6 Weeks Bout of this deadly disease. And I said, guys, as for us, people with transplants, it is very, very important that we continue to keep distancing away from people. Like I said, things are opening up in phase 3 right now in my state, and I'm sure in many states right now. So it is very, very important for us as transplant patients, and of course all kidney patients, to be vigilant about our health, which means safe distancing at all times from other people's, wear a mask at all times, gloves, keep our hands washed constantly, not touching our face, because as you see with Mary Ann, just because she was doing everything right, by doing everything she needed to do, she still caught COVID-19. So this story really emphasizes to me that, we can do everything right and still run into this disease. So what we need to do, of course, first is always take care of ourselves first by doing what we need to do to stay safe. So guys, this video. Hopefully you liked it. And if you did, please like, share, and subscribe. And I hope this information helps all those with transplants like myself, because this information is very important, not only for me, but for others with kidney disease and all people with immune systems. So guys, I send you so much love, of course, always, always, and so much affection, because we are all in the same boat right now, guys. We are trying to stay safe, to keep our health steady, and to do everything we can to not only for ourselves, but for those people around us. So guys, the only thing that we have to do, of course, always, always, is listen to our doctor's orders. Listen to the CDC, follow, your kidney organizations, because they will have every piece of information that you need in order to fight this disease and to stay safe. So guys, take care of yourselves, and I will see all of you on the next video. Bye.